everyone, and thank you for joining us here today for the final webinar on the EU MDR transition, where I will be co-presenting with Maren Steer and Craig Davis. So in today's webinar, I will run through very quickly the background and context of the EU MDR transition and implications, which was covered in the first webinar last week. I will then pass over to Maren, who will talk about when consent to supply is required and when notifications are required for the lapsing of conformity assessment certifications. Maren will also be working through some examples to highlight and clarify regulatory obligations for devices that are transitioning to the EU MDR and also for devices that are not transitioning. Craig will then touch on recalls and streamlined market notifications. We'll then do a recap of the fee reduction measures and online resources to support sponsors before moving into our Q&A segment. So in Australia, most medical devices in the ARTG are supported by European certification. And in 2017, a major update to medical device regulations in Europe was introduced, and the new medical device regulations replaces the Medical Devices Directives and the Active Implantable Medical Devices Directives. This transition ends on the 26th of May 2024, where devices supported by EU MDD certification will need to transition to the new EU MDR certification in order to continue supply. And this has flow-on implications for sponsors of medical device ARTG inclusions in Australia. The regulatory actions that may be required from sponsors is wide-ranging, and today we will be focusing on 3 of them. Recall actions following the Uniform Recall Procedure for Therapeutic Goods, streamlined market notifications to advise end users of low-risk changes, and consent to supply due to non-compliance with essential principles. And a suite of guidance material was published on the 1st of December, including guidance specific to recalls and market notifications, conformity assessment, essential principles, and consent to supply. These guidance material also includes a number of example scenarios and FAQs to clarify regulatory obligations. So I highly encourage everyone to check them out. And I'll now pass it over to Maren, who will take you through consent to supply certification lapses and some examples.
So I'd like to introduce Maren. Maren Steer joined the Therapeutic Goods Administration in 2018 and is the team leader for the Devices Verification team in the Devices Post-Market Reforms and Review section. Prior to this role, Maren worked as an investigator in the IRIS team investigating adverse events for Class 2B, Class 1S and Class IM devices, is it? Maren has 10 years nursing experience in the emergency department and holds postgraduate certificates in both clinical education and emergency nursing. Thank you, Maren.
Wonderful. Thank you so much, Rachel. So this slide here is just pretty much going through and highlighting the differences between consent to supply and notifying of lapsed conformity assessment certification. So during the transition from EU MDD to the EU MDR, sponsors may need to apply for consent and also notify the TGA of lapses in conformity assessment. A couple of points to note that have come out of the questions we've received from the past couple of webinars. There are criminal and civil penalty sanctions if a sponsor fails to notify the TGA within 60 days of becoming aware that a conformity assessment document, other than the conformity assessment certificates issued by the TGA, has been restricted, suspended, revoked, or is no longer in effect. And you can refer to the Therapeutic Goods Act, in particular sections 41 MP, 41 MPA, and Regulation 5.7 from the Therapeutic Goods Medical Devices Regs. And if you have notified that an MDD certificate has expired on the date or after within the 60 days, you don't need to halt your supply whilst you wait for the TGA's response, so long as you are supplying products that have been manufactured prior to the MDD certification expiration. So this is just a quick snapshot of what the consent to supply and the notification forms are. We will obviously send out the web links to each of those, but the consent to supply application is found through your TBIS account. And if you have any issues accessing it, just contact the TBIS help desk. The lapses in conformity assessment certification notification form is found on the consultation hub. So they're found in 2 different places. These are some examples of what we would consider non-compliance with essential principles, and these are common things that we're seeing in the transition from MDD to MDR. So the first dot point there is an example of a breach in Essential Principle 13. The second is an example of a breach of EP3 and EP14. The third is an example of a breach in EP2 and possibly EP1. And the fourth is a direct breach of EP13. So it's important to note that from one thing, there could be a couple of breaches in their essential principles, or it might just be one essential principle that's been breached. So the next few slides are a repeat from webinar 1. And we'll be moving into the various handling approaches for the transitioning and non-transitioning devices. But before I do so, I'll step through the regulatory obligations, taking into account the manufacturer and supply chain considerations for devices. So from left to right, we start with the manufacturer of a medical device. For medical devices included in the Australian Register of Therapeutic Goods, i.e. the ARTG, the manufacture of the medical device you wish to supply in Australia can only take place when there is a valid conformity assessment certification in place. Devices manufactured without valid manufacturer's evidence cannot be supplied in Australia. If the stock is manufactured overseas, it will make its way to the Australian sponsor. If the manufacturer or sponsor realise at this point their medical devices are no longer compliant with the essential principles, and that stock is within the control of the sponsor and hasn't yet been supplied, consent to supply is required. The sponsor will need to apply for this consent, but for your awareness, just wanted to point that out. Next, the stock will go through to a distributor, a supplier, or a customer. If at this stage the manufacturer or sponsor realises that their medical devices are no longer compliant with essential principles, consent to supply isn't required as the stock's already been supplied. However, recall actions or market notifications would be required if it was unsafe or if there are changes that healthcare providers or end users would need to be aware of. So we're running with the same example that we've presented in webinar 1. But I'll just talk to a couple of extra examples and some questions that we've received. So the 3 examples, the first is for a non-transitioning device. The second is for a transitioning device with a gap in certification. And then the third example is for a transitioning device with overlapping certifications. The context of the example is of a hip implant that's currently in the ARTG and is supported by an EU MDD certificate, which states the hip implant is suitable for both paediatric and adult populations. However, the EU MDR certificate has a reduced scope and states that the hip implant is only suitable for use on the adult population. So in this first example, the manufacturer has decided not to transition their device and did not seek EU MDR. Under our legislation, sponsors must notify the TGA within 60 days of becoming aware of the lapsing certification. It's important to note that criminal and civil penalties if the sponsor fails to notify us within the 60 days of becoming aware that the conformity assessment has lapsed. If a sponsor has no valid conformity assessment certification within the 12 months of the MDD certification expiring, then sponsors are generally expected to cease supply of MDD stock, which has been manufactured under a valid MDSAP MDD certificate within 12 months of that expiry. The TGA will consider lapses on a case-by-case basis and may contact sponsors at the 12-month mark to ascertain the situation. The TGA may cancel or suspend the ARTG entry that no longer has the conformity assessment certification. We've had a lot of questions asking what is the legislative basis for the 12-month time limit to exhaust the MDD stock. I just thought I'd take the time to remind that at all times, while the inclusion of the device in the ARTG has effect, the sponsor must have available sufficient information to substantiate that the conformity assessment procedures have been applied to the kind of medical device in the ARTG and ensure compliance with the conditions stated in 41 FN of the Act. This slide here, we just wanted to note that our approach to the cessation of supply is not dissimilar to Europe's, where MDD compliant devices may be made available for a 12-month period post MDD certification expiry until 27 May 25 and must then be removed from the market after this date, regardless of where stock is in the supply chain. So this example here is when we have a gap in certification between the MDD certification and the MDD certification being issued. So upon getting the new MDR certification, your regulatory obligations and actions as the sponsor will depend on whether or not the MDD stock is to be supplied with the old, broader MDD indications and intended purpose, or with the new narrow MDR indications and intended purpose. So in this example, the sponsor is seeking to supply MDD stock with the narrower MDR indications. The sponsor will therefore need to update their labelling to remove indications of use for children on the MDD stock in the red shaded box. If labelling is updated to remove the use on children, then consent to supply is not required for the MDD stock. But if the labelling is not updated, then consent to supply would be required for the MDD stock due to the non-compliance with Essential Principle 13. In the second example, the sponsor is seeking to supply MDD stock with broader MDD indications. If the manufacturer holds appropriate clinical evidence for the use on children and wants to continue supply of the MDD stock for use in children post the MDR certification, they are free to do so and they don't need consent to supply as there's no breach in the essential principles. Please remember that the TGA may ask for this evidence at any time whilst the device is included in the ARTG, which the sponsor is required to provide within 20 working days. However, if the manufacturer does not hold appropriate clinical evidence for the use in children and wants to continue the supply of the MDD stock for use in children post MDR certification, consent to supply would be required for the stock in the red shaded box due to the non-compliance against Essential Principle 14 that relates directly to the clinical evidence. In this third example, there's an overlap in the validity of the MDD and MDR certificates. The manufacturer can supply under both MDD and MDR certification with different indications, which is allowable if the relevant certification is in force and the manufacturer holds all evidence to demonstrate compliance against the essential principles. If the sponsor is supplying MDD stock with broader MDD indications post getting the MDR certification, as outlined in the red shaded box, the TGA may perform random checks prior to the EU MDD certification expiry and request that evidence to verify compliance. e.g. requesting for clinical evidence to verify compliance with Essential Principle 14. We've had a couple of questions about additional warnings being added to labels in the transition to MDR. And for clarity, if the transition to MDR, there is a new warning that must be added to the labelling, the TGA would consider the previous stock manufactured without this warning a breach of Essential Principle 13. Item 5, which states any warnings, restrictions or precautions that should be taken in relation to use of the device must be provided with the device. Again, at all times, consent to supply is not required if the device is compliant with the essential principles, but the sponsor must notify the TGA within 60 days of their EU MDD certification expiry, and then follow up by notifying DVS at health.gov.au of their new MDR certification.
Thank you, Marion. We'll pass over now to Craig Davies. So Craig, while I just set you up, I'm going to read over, do an introduction for you. So Craig joined the Therapeutic Goods Administration in 1990. Since the early 2000s, he has managed sections with responsibility for advertising, regulation, export, medicine application, the Adverse Drug Reaction System database, and a range of international and national secretariat functions, including the Global Harmonisation Task Force and numerous TGA expert advisory committees. In 2016, Craig was appointed to his current position as the Director of the Recall Section in the Manufacturing Quality Branch. This section is responsible for coordinating recall actions for therapeutic goods which are undertaken for goods already supplied to the market for which there are deficiencies in relation to their safety, quality, efficiency, performance, or presentation. Thank you, Craig.
Thank you, Rachel, and good afternoon, everybody. So look, as part of that bio there, Rachel sort of covered what the definition of part of the definition of a recall action is. It's shown there on the slide. I won't read it out other than to point out the second dot point there that under the Uniform Recall Procedure, there are 4 distinct type of recall actions that we coordinate, being a recall, a product defect correction, a hazard alert, and a product defect alert. Before I move on, I think I need to make the point and be very clear that the TGA acknowledges that the MDD to MDR transition is a very large undertaking. Some people have used the word, it's a once in a lifetime regulatory change, and it involves a very great number of products that sponsors are looking to transition from the old MDD into the MDR and then to enable continued supply under Australian legislation. In recognising that, our approach to this exercise has been aiming to develop processes which will allow this transition to occur in as streamlined a fashion as possible, but at the same time ensuring our respective obligations are still being satisfied around ensuring that products being supplied to the market continue to be of high quality, are safe for use and perform as intended. And to inform customers of any necessary changes that are being made to those products. With regard to my function in managing the recall section, I guess with having set the scene like that, my intention of where we've landed in developing this process and the journey we've been on is to hopefully ensure that the vast majority of products that are transitioning because of this regulatory change only actually are able to stay away from myself and my team. You do not need to submit notifications to undertake recall actions, noting that some of the changes that are being made do fit the definition of what a recall action may be under the current URPTG. So in having regard to that, we've tried to come up with some guidance. The guidance is published on the website, and I will talk briefly to it in the next couple of slides. And the guidance, or the intention of the guidance, is to provide information around different factors that may be affecting product, where the changes are of a nature of their low risk, or low safety risk, non-safety related overall, and we're happy for them to transition through the streamlined market notification process that we've developed. So in moving on, what is a market notification? So I'm now talking about the new process that's been developed as part of the MDR transition exercise. I'm not talking about the processes in the uniform recall procedure for therapeutic goods. So the market notification is intended to provide information about a therapeutic good in a situation that's unlikely to involve significant adverse health consequences, and is intended to notify customers of information relating to MDD certified device stock already being supplied to the Australian market. If certain criteria are met, the sponsors of medical devices transitioning to the MDR can undertake a streamlined market notification and do not need to submit these as separate recall notifications to the recall section that I manage. The sponsors who qualify for the streamlined market notifications can either submit an online notification form and use the web publication service that we've developed and have made available for sponsors to use in order to notify your customers in an efficient manner. Or you can choose to simply notify customers on your own volition, as you may contact your customer base regarding various other commercial arrangements and non-regulatory matters that you don't ordinarily need to communicate to TGA about. The key to being able to do a streamlined market notification for an MDR transition change is that you are able to answer yes to all 6 of the following eligibility criteria. I won't read them out, you can read them on the slide. But again, in summary, we're looking at that these are changes that are simply as a consequence of products that are transitioning from MDD to MDR. We are taking a view that where a product being supplied to the market today that was compliant with MDD, that those changes should be able to be transition across into MDR and then go through the market notification process rather than a recall notification process, even in cases where that might mean a change to the IFU. So, and as we go on to say there, that the devices are meeting all regulatory requirements as currently supplied. There are no deficiencies in the products. There's been no reported safety incidents or complaints or any signals arising from adverse event reporting. And of course, the devices were manufactured whilst a conformity assessment certificate was valid. This just shows you the information that we published on our consultation hub. The document will be, this is where the full guidance document is that you'll be able to read in your own time if you haven't already done so, and to also follow through the market notification process that is described within. Moving along, this is an example of the web publication service that my colleagues have developed for sponsors to use. So that will be accessible by sponsors to populate the information into there, upload that. It will sit on the TGA website, and so people accessing our website directly will be able to log on and search these spreadsheets if they choose to, and you can also provide web links to it to inform your own specific customer base that you have now you're utilizing this mechanism for market notifications, and details about your products and the changes being made are being presented in the table as being shown there. And as indicated in the slide there, the spreadsheets will be updated on a weekly basis every Tuesday. And just finally, that is showing a flowchart which describes the process, I guess, as a visual there for you, and is complementary to the guidance documents that we've been published. That's where I will leave it at there. Thank you very much.
Thank you very much. So with regards to fee reduction measures for consent to supply, we have introduced a reduced fee of $30 per ARTG entry if the only aspect of non-compliance is in relation to Essential Principle 13. For any other non-compliance against any other essential principles, it will be a full fee of $500 for the first ARTG entry and $100 for every subsequent ARTG entry. And for a consent to supply application, the implementation plan is required from the sponsor. And do note that the web publication service for streamlined market notifications is provided with no charge for that.
Okay, everyone, we have, we'll be starting in just a moment the question and answers. And because we have gone over a little bit in time, I think we'll be happy if Xingling and the speakers stay online for a few more minutes longer if you're available to do so. And I'll let you take over when you're ready. Thanks, Xingling.
Thank you very much, Rachel. So myself, Baron, and Craig will be answering questions, and we have Ben who is kindly assisting us by reading out the questions. So over to you, Ben.
Great, thank you, Xingling. So first question, what impact will the proposed EU MDR extensions make on the transition process? And will MDD certificates automatically be deemed to expire in the 2027-2028 year?
Thank you, Ben. So we understand that legislative processes to enact the changes is expected to begin in early 2023 in Europe. So we will be closely monitoring the situation and will continue to review our approach, and we'll be making adjustments as necessary to minimize disruptions and to minimize regulatory burden as well.
Great, thank you, Xingling. Are there any circumstances where the TGA will approve consent to supply devices manufactured after the MDD CE certificate expiry and prior to obtaining the MDR certification?
No, there won't be any circumstances where that can happen due to the fact that there is no provision in the Therapeutic Goods Act that allows us to do that.
Thank you, Maren. In instances where we have notified TGA of the expired MDD certificates via email, must we re-notify using the lapses and conformity assessment form again?
That's a case by case. So ones that have come in via email and the TGA has responded to and liaised with you and had an agreement in place, no. If you've only just become aware of the notification form and you've happened to have sent in an email, you'll probably get an email back from me in the near future just requesting you pop it through the notification form pathway for us.
Great, thank you, Maren. We have a similar question to the first one. So with the proposed extension to the EU MDR introduction by 3 to 4 years in a staggered timeframe, when will we see the TGA making changes to align with this change?
Sure. So as mentioned earlier, we will certainly be closely monitoring the situation and doing what we can to allow alignment where possible, and really seeking to minimize disruptions and also regulatory burden.
So what is the legislative provision or the clause which requires sponsors to issue a market notification for the examples provided in the TGA guidance document?
There is no legislative provision for the market notification process that's been developed. We have developed it having regard to existing business as usual processes revolving around the 3 business areas that are represented today, recalls, the post-market team that looks after consent to supplies, and Xingling's team that looks after device applications. Specifically in my area of recalls, people who had dealings with us would understand that the URPTG is a guidance document that is published on our website. it in itself is not a legislative instrument, but there are mandatory powers in the legislation that allows to mandate a recall on public safety grounds if necessary.
Great, thanks, Craig. Sorry, question just moved on me. If the manufacturer does not have an MDR, can they still use the MDSAP route?
Yes, they certainly can. So the MDSAP route can be used, or any pathway outlined in the therapeutic goods, medical devices information that must accompany applications for inclusion. It's a 2018 determination. So that document will outline the various pathways available based on the device classification.
Thanks, Elaine. Is consent to supply required after an MDD certificate has been expired for label changes, like warning and logo, even if they continue to comply with the essential principles?
As I went through before, if there's additional warnings that are now required in the MDR certification, then the TGA would consider the previous stock manufactured under the MDD certification to now be non-compliant with Essential Principle 13, because item 5 of Essential Principle 13 states that all warnings must be provided on the packaging or device. So yes, consent to supply would be needed.
Thanks, Maren. What is the difference between applying for a new ARTG under MDR certification rather than terminate old ARTG and varying entries in the existing ARTG?
So they are both valid actions, although depending on the classification of the device and the risk profile, the new application for inclusion may be subjected to a non-mandatory audit or potentially a mandatory audit. So if the MDR certification does not change the kind of device, then a much more straightforward pathway is really for the sponsor to update their existing ARTG entry.
Thanks, Elaine. Why is the sponsor expected to use the streamlined market notification form if it wouldn't require a recall action under ARTG?
TGA's made a decision that in the interests of transparency, it's important that sponsors notify their changes to their medical devices to their customer base. Now, this contributes to ensuring the ongoing safe and appropriate use of the goods.
Thanks, Craig. Please give an example of what documentation is expected if sponsors are notifying customers on their own and not using TGA streamlined market notification.
That is something that we would leave to individual sponsors to decide what is best fit for purpose for their own businesses. I guess I would envisage just correspondence. You could develop a letter, send it out by email. If you have a number of similar or like products and associated accessories, you might be able to just have a simple covering letter and have those in an attachment to that letter. Probably very, very similar to any other commercial correspondence that you would engage with your customers, and correspondence of a nature that you ordinarily would not be needing to communicate to TGA about. But again, I'd emphasise in making those decisions, again, just going through and ticking off the 6 eligibility criteria and ensuring that you can answer yes to each of those 6 criteria to ensure that you qualify for that market notification process as opposed to having to come through the formal recall notification process.
Great, thanks, Craig. So it looks like another one on the hot topic. So with the proposal late last week to further extend timeframes for transition, decision due in 2023, will any published timeframes from the TGA also be extended?
Thanks, Ben. It's certainly something that we will be considering. Given how fresh the news is, we are, as mentioned earlier, really keeping a close eye on the developments over in Europe, and ensuring that where possible we will be aligning.
Great, thanks. If the manufacturer is not transitioning to MDR, can we register the same product under the MDSAP route? and continue with the sale of the product?
Yes, that is not a problem. MDSAP is recognized as valid certification. The sponsor will just need to make sure that the scope of the MDSAP certification does cover the devices within the ARTG entry.
What are the supply options for essential critical devices with expired MEs, while sponsors wait for the MDR certification? For example, special access service supply.
Yeah, so if you were to go down the route of using the special access scheme that the TGA has, your ARTG entry needs to be suspended or cancelled because the special access scheme can't grant a supply if the product has an active ARTG entry. So we could suspend the ARTG entry on your behalf. You would have to just double check your timeframes and be pretty certain when your MDR certificate is expected to be issued, because there are timeframe restrictions on how long the TGA can have a suspended ARTG entry.
Thanks, Maren. Can TGA confirm that devices such as instruments and capital equipment supplied under MDD can continue to be used after the May 2025 cutoff expiry date or end of life?
So as mentioned in the examples Maren had provided in this webinar, at present, upon the expiry of the MDD certification, sponsors must notify us within 60 days, and they're expected to see supply within a 12-month period from the expiry if there's no valid certification thereafter.
Great, thanks, Celine. Please elaborate when or when not to advise the ACCC of market notifications and/or recalls and TGA involvement or interaction with ACCC in this process.
Okay, so following the premise that if you are doing a recall and you're following, our BAU processes following the URPTG, and if the medical device also fits the definition of a consumer good under the Australian consumer law, you do need to notify the ACCC that you are doing that recall as well. Now, on the basis that, again, subject to satisfying the 6 eligibility criteria, you will not be doing a recall. You will be doing a market notification as per the process we've established. You should not have to notify the ACCC of that. They haven't been involved in our discussions in terms of this regulatory change, given that it is a regulatory change affecting medical devices under the therapeutic goods framework rather than the consumer law net framework.
Great, thanks, Craig. The EU have said that capital equipment in health institutions supplied under MDD can stay until the end of life. Will this also be the same in Australia?
Thanks, Ben. We will certainly be reviewing that and our approach and updating our approach and guidance when we come around to that in the new year.
Thanks, Ellen. How long will a consent to supply take? Is TGA able to handle the potential volume of requests?
So the potential volume of requests is going to be about the same as what we had when we had the pick and the pill requirements go through in December last year, and we were able to cope with that workload. So we do forecast that we can cope with this workload. As consent to supplies applications come through, if the payment is received, from that date of payment, if the sponsor has given a sufficient amount of information to show us that all risks associated with the breach in essential principle has been mitigated, and there is some kind of plan in place to work towards being compliant with the essential principles, it only takes us 5 days to turn around. However, if that information isn't sufficient for the TGA to make a decision on granting consent to supply, it can take a lot longer. And this is when we see our consent to supply application turnover times blow out, because we then are waiting on further information before we can make a decision.
Great, thanks, Maren. Will the TGA revise the 12-month use-by date for products that have expired manufacturer evidence and bring it into line with the MDD proposed changes?
Thanks, Ben. So where possible, we are certainly seeking to be aligned. Our ultimate goal is really wanting to minimize regulatory burden, cost, and impact on supply, but yet at the same time ensuring that it doesn't compromise safety, quality, and performance. So certainly something that we'll be looking into.
Thanks, Celine. Why are market notifications required in Australia if the information is supplied with the product itself and not an EU requirement?
Well, Australia as a sovereign country makes its own decisions, under legislation it administers. And as I alluded to earlier, decisions have been made at senior levels to that it is important to communicate changes that are occurring to medical devices under the MDR transition to the customer base and end users who are people working at the coalface of healthcare on a day-to-day basis. So it's all about transparency of communication. If the EU have made different decisions regarding this matter, that's certainly a matter for them. Australia's made decisions as to how it believes transparent communications should be facilitated.
Thanks, Craig. We just hit 2 o'clock, so we'll take a few more questions before we wrap up. Yeah, so if the changes in IFU are made as part of the MDR certification, but the MDD certified devices are still compliant with the EPs, why is a market notification required?
Well, okay, yeah, thanks. And sorry about the confusion there.
No, that's okay.
Presumably it's to do with some kind of, there will still be a change in some manner to whether it's the usage instructions or the addition of a warning, removal of a warning, that would need to be communicated to the market. Now, I guess what we're looking at is changes that are relevant to the quality, safety, performance of the devices. We're not looking at changes if there's some minor typographical corrections to an IFU, or if a company changes an address or changes a contact information on an IFU, or other minor commercial type matters. Again, they wouldn't be requiring market notification. So this is all about regulatory changes to the devices that may have an impact on quality, safety, performance. And again, we're trying our best to minimize the regulatory burden here by developing the criteria that we have done, and hopefully people are able to answer yes to those questions. And it goes back to that high level principle I mentioned earlier, that if the devices are compliant as they're being supplied to the market today, all going well, they should be compliant under an MDR transition. Noting there will be different circumstances, and as some of the examples in the guidance we have provided, and Mary used an example there of like a change from where a product being used in a pediatric population is no longer to be able to be used in a pediatric population. Significant type changes like that, we do need to know about.
Thanks, Craig. So we might wrap up with this final question. So if the sponsor genuinely misses the 60-day notice of expiry, what should they do?
you should notify the TGA ASAP. If you've missed it, just pop in, give us a reason why, and then we can work with you to have a look at your ARTG entry and decide whether or not it should remain active, or whether any regulatory action needs to be taken, or if any infringement notices need to be issued due to not meeting the requirements of the notification.
Okay, thank you, everyone. Look, there are many more questions to get through, and I believe that the team have a website and they have some published Q&As already existing, and they will go through all the questions again today to ensure that if there is a common theme, that they'll be adding those Q&As to the existing publication. So thank you very much for your time. We will keep the questions open in the Slido app for you to access through the browser for another hour or so. So if you do have any more questions you'd like to pop through, you're welcome to do so, and also completing the survey. Thank you very much, everyone. Thank you all to the panel, and have a lovely day.